It's really important before we begin to talk a little bit about definitions. So I'm sure many people have heard of the term or read the term or seen the terms complementary or alternative therapies. And if you are currently using these therapies or interested in exploring these therapies, in having a conversation with your healthcare providers, it's really important that we try to avoid the term alternative therapies. Alternative therapies kind of denote those therapies. So like acupuncture, yoga, diet, or nutrition, supplements. So therapies used in place of conventional care. So setting aside cancer treatment and then just doing things like acupuncture or yoga to help yourself during your cancer journey. Complementary therapies, on the other hand, denote that the therapies that are used as a complement alongside conventional medicine. There are three specific themes of why people typically choose to and want to incorporate these integrative therapies into their care. So number one, they want to feel like they have a greater sense of control. Number two, they want to do everything possible, certainly things that are safe, right? And they also do these therapies because as they start doing these therapies, they feel empowered. And what's really interesting is that from a scientific perspective is that people who feel empowered actually feel like they have greater satisfaction in the care that they're receiving. They have greater adherence to their treatment regimens, and they typically have better outcomes. And for those of you who might be interested in exploring integrative therapies because you're interested in being a greater participant in your care, you want to feel more greatly empowered, you want to work with someone who can help you achieve that, there are 6 things that I want you to keep in mind when selecting a complementary health or an integrative medicine provider. And this comes directly from the National Center of Complementary and Integrative Health. So number 1, please, please, please communicate and ask with your doctor if in fact there are practitioners in the medical centers that you're going to. Find out as much as you can about any practitioners, including their education, training, and licensing. Number 3 is find out whether that practitioner is willing to work together with your conventional healthcare providers. And when you meet with that person, make sure that you are willing to explain, your health condition, and as well as, ask that person to feel comfortable making, that you get all of their information regarding their training and experience, and make sure that they have experience working with people who have been diagnosed with cancer. Oftentimes when you think of a needle, you'll often probably, bring to mind the image of the medical syringe, right? When you get your blood drawn or whatever. And so an acupuncture needle in comparison to that is super thin. It's super flexible. It's actually just a tiny, tiny little filament. So the great thing about acupuncture is that we're seeing a lot of evidence start to roll in about its ability to help in symptom management for people with cancer. And so we know in the literature that acupuncture can be helpful at managing pain, things like nausea and vomiting, loss of appetite, help you with anxiety, depression, insomnia, fatigue, hot flashes, peripheral neuropathy, right, which is a form of nerve pain, and GI issues. What is really interesting is that when the needle gets inserted into the skin, it communicates with what are called ANC afferent fibers in the skin, which then sends a cascade of communication up the central nervous system and into the brain. And it's actually the brain that then releases endogenous opioids, which is our natural pain blocking chemicals. We know that it reduces inflammation. We know that it boosts the immune system. We know that it brings oxygen and blood to areas of injury. And we also know that acupuncture kicks out serotonin, which is that kind of well-being, feel-good, relaxation hormone.